Welcome to this introduction to the Masterclass for Ethics at the End of Life Care. My name is Martin Woods. I'm the Research Fellow here at Mary Potter Hospice, and I'm going to just take you through, in just a couple of minutes, the main aims of the day. In many ways, ethics has become the most central of topics in healthcare in the last few years. This is because of the rise of the use of technology, of the difficulties involved in liaising between patient, doctor and nurse within a complicated healthcare system. Ethics has been applied to end-of-life care situations in recent decades increasingly. This is mainly because a great deal of issues have arisen in the last few years which in the past were perhaps not considered to be major ethical concerns, but they certainly are now, and any modern healthcare practitioner should ensure that they're fully covered as far as ethics and end-of-life care situations are concerned. I talk, for instance, of the development of advanced care plans, living wills, the use of terminal sedation. We will be looking at ethical cases and scenarios in the afternoon taken from reality. These realities are now exceedingly common within end-of-life care ethical situations, and the entire group of participants will be involved in examining a number of cases so that they can then learn more effectively how to reach acceptable ethical conclusions about the care that is required for people at the end of life. Last but not least, of course, we will be attempting to address the exceedingly difficult issue of euthanasia, which has become exceedingly popular in recent years, especially here in New Zealand, where great debates have been held over the last 2 years at least, parliamentary inquiries, and so on. We will address this issue through the use of an expert panel, and this session promises to be highly interesting, I'm sure, for most of you. We will, of course, be paying particular attention to the viewpoints not only of the doctors and the nurses involved in the care of patients at the end of life, but their families, the patients' families. And in particular, we will be developing a number of ideas across the cultural spectrum. In particular, there will be a special emphasis on Te Ao Māori, because this issue, of course, in the past has often been an issue which has been either ignored or pushed to one side of some of these debates, and yet there's a great deal to be learned from such a perspective. To achieve this, we have another expert from the Maori community involved who has consulted with Kaumatua and who has collected a number of recent perspectives on the end of life, including perspectives on such a difficult situation as euthanasia and other particular problems at the end of life. This then, therefore, should increase our understanding of a cross-cultural situation in New Zealand and be of great benefit. I look forward to seeing you all on Friday, the 9th of June at the Home of Compassion, and I'm sure we'll have an interesting day with some vigorous debate, especially in the afternoon where we're looking at our cases. Until then, Haere Rā.